having meetings with agencies. There's been
Okay, I understand completely. Joyce, do you have anything you want to ask of Eileen?
Joyce, sorry. Joyce,
Yes.
any questions?
Chris?
Do you have any questions for Eileen?
It's very hard to hear you, Debbie. I'm sorry. You sound like you're underwater. But
Can you hear me, Joyce?
very clearly.
Okay.
I would just add in with Eileen that IAC is working with the agencies also on developing a reopening plan and a reimagining plan. We're meeting like twice a week to discuss that. So right now, we're working in tandem basically with OPWDD on these kinds of things.
Okay. Can you hear me now clearer, Joyce?
yeah.
I hear Chris
yes.
clearer, but it's better.
Okay.
Yeah, exactly. Everybody's working together, and again, as this is such a unprecedented situation. Everybody's, Albany is working, DOH is working. I know the agencies are working. Everybody's, trying to come up with a plan that'll allow people to get services while at the same time allow people to stay safe.
Right.
And as the chair of the committee that oversees families with the children living at home, I want to personally thank you, Joyce, as well as you, Eileen, working together so that there are services that will be able to eventually come back for our families, especially more our individuals who need the help and services. And we know it's a very difficult time right now. And right until we know that we are going back to a new type of where we can have meetings in person, for now, the safest thing will be do it through Ring Central or Zoom, whichever video conferencing methods we can do. Did you hear me? Was I clear?
Yes.
Okay, because I'm practically on top of it.
Okay, well, let me ask. Does anyone have a question?
And I also just want to say, we're waiting to see what happens with camp. If and that's again another statewide issue. Is our camps going to be opening this summer at all, or in a limited way, or not at all? So we're that's another thing that's on the list of things we're looking into.
Mm-hmm.
Yeah, I understand that. That's a very big, important issue coming up. Does anybody else have any questions for Eileen Zacco, who's here from the Brooklyn DDRO? Anybody?
Guys?
Anybody have a question, concern?
Can you put it on chat? Or if you're on the phone, can you press *6 and unmute you, and then you can ask that question for Eileen from OPWDD. I know you guys have questions because some of you had questions at the CCO meeting.
That's right, you did.
So anyone from the Advisory Council Exec Board or DD Council Exec Board, do you have a question? Is anyone there? Because I'm going to unmute. Let's see. Let's double check.
Okay, I have a question.
Yes, Andy. Go ahead.
Go ahead.
Okay. Will OPWDD have enough funds in the coming fiscal year so that they'll be able to have services for the families?
Did you hear that?
Okay, I heard part of it. Will OPWDD have enough? I didn't hear the word.
money to be able to open and maintain the program, because we're very concerned that is a possibility you may not get all the money, stimulus and Medicaid money that's due you, and it could seriously affect services. So that's what Miss Cindy Napier was asking.
Right now, I haven't been made aware of any cuts. I mean, again, that's also fluid. Because again, there's stimulus packages, there's things going on. So that it's too early to tell. But right now, things are going forward as there's some COVID guidance, but other than that, things are still going on. And there's alternate billing that's for waiver though with COVID guidance. There's an Appendix K, and that's way too lengthy to get on, to go over on a phone call. But right now, services are the same way as they were. Well, as far as there's been no cuts as of yet, and there might not be.
Yeah.
And I suggest everyone to also pay attention to the governor when he does his press conference, and it's also available on the YouTube page, because lately a lot of the news stations have not paid close attention and they're giving wrong information at the same time. So I suggest everyone to listen to the governor, what he's giving a day-by-day report. That's another way of finding out the information. Doris, you have a question? Because it popped up.
Hello.
You off mute.
Hello, this is Jessica from Tri-County Care.
Go ahead. You have a question for Eileen?
Yes, I do have a few questions for Eileen. Hi, Eileen. This is Jessica Williamson. I'm an intake specialist and outreach person for Tri-County, and this is in regards to enrollments and how we can work better with OPWDD to have a clear picture about how enrollments will continue to be affected. So I guess number one would be, is there a guidance or a general info about what is to happen for each borough in regards to getting enrollments completed? Is there a guideline for that right now? And is there any type of leniency for any of the documentation that is needed for enrollment?
Are you talking about CCO or are you talking about services?
I'm from Tri-County Care, so yes, it's CCO.
Okay, you should send our CCO specialist an email, and I'll give you his email.
Mm-hmm.
He can go over with that with you. Hold on, I'm just going to pull it up.
Okay. I actually don't have access to being online because it's not working for me, so hopefully I can get that in the email.
Okay, it's Chris.
Yes.
Yeah.
It's Henry Najibi's email. Can you email that to her, or I can
Sure.
email to you? I can announce it if you need it. It's Henry.NJIBE.
Najibi. Okay.
So it's Henry, HENRY.NJIBE, B as in boy, Najibi, at opwdd.ny.gov. He's the Brooklyn CCO.
Okay. Awesome. Great. So as far as using the CCO alert email, I'm not sure if you would have an answer for this, but is there a way that we should use it and not have pushback from using it too much at this moment? Because I know a lot of the intake specialists are emailing the alert email to find out updates for certain documentation. So again, I guess that would be like a guidance issue as well.
Are you talking about eligibility now?
Yeah, so
you should, as far as I know, you should be continuing to email the alert mailbox. And our eligibility team goes in there and I mean, because I know that I've been signing LLCs.
Correct. Okay.
For the last, pretty much, after the first 2 weeks, the first 2 weeks of the pandemic, everything was, a little, getting everything together. But I've been consistently signing LLCs for Brooklyn. So the LLC process is continuing and has been continuing.
Oh, that's awesome. Yeah, I mean, I definitely did get a few LLCs, but, also just to move over some of the frustrations that's been happening between CCO and OPWDD, especially with the with using the email. There's been a lot of pushback as to not send any, do not contact or do not send any further emails regarding a follow-up. So it's just really hard to not follow up or to not ask, and then to be pushed back with, a disdain or don't contact us. And I'm just, I just would like to have more guidance on that as well.
you know what, I can't really comment on the other thing if you know, on another unit, but we do ask everybody in general to be patient. You know, it's tough times for everybody,
Yes.
including, you know, the agencies and us. And I know, on other things, I have agencies that submit something today and email me today. You know, did you get it? Do I have it? Was it ready? And you know,
Yeah. Yeah.
And I'm sure you have people you're in contact with that do the same thing, and then there's other people, you know, wait a reasonable time. So I don't know where things are, but if you want to, send me an email and I can follow up on you know, what the right length of time is. But,
Correct.
you know,
Yeah, that would be awesome.
There is a backlog. You know, there is a backlog, but things
Yes.
are moving. And over the last couple of weeks, things are moving quicker than they were prior to that.
Awesome.
Eileen, this is Chris. You have 3 people have questions. Pat Lou, Sharon Shields, and Lori Rosenfeld. Okay, Pat Lou, can you please answer your question? And you're not, and everyone should be off mute right now. You don't need to press the *6. I got you. Just say your question. Pat Lou. Okay. Going up to the next person. Sharon Shields.
You there, Sharon?
Sharon Shields, do you have a question? Okay, guys, can we all stop playing the *6 button and answer? If Sharon Shields,
Chris?
Yes?
This is Angela. Can you hear me?
Loud and clear.
Okay, Eileen, doesn't the email have a specific amount of time for the person to contact back to the DDRO? I believe it's like 30 days.
I believe that's correct. I'm actually emailing the director of eligibility right now, so I'm right now to find out. So
right, but we get emails. I get emails to follow up on stuff that was only just submitted. I mean, this time the agencies have to understand that all sitting in the.
I get those too. That was my example. So I get people who email, something, send something today and email. I'm actually reaching out to find out what the
Right. I believe it says 30 days.
Okay.
But they have.
He has to go.
We're reviewing as fast as we can for all of our work, not just the disability stuff. We're not sitting in the office.
But that specific question, yes, was about eligibility. But I agree. Everybody, everybody's, victim to the same set of circumstances. So.
Okay, let me repeat these names again. Pat Lou, do you have a question for Eileen? Because you asked me that question. Sharon Shields. I hear someone coughing. And, okay, Lori Rosenfeld.
All right, I know Lori's question. She asked something about reimbursement. Is family support reimbursement program still going on now?
Yes, they are. Angela, you can answer that.
Hello?
Guys, you're off mute. Can someone please answer this question?
Angela, can you hear us?
I cannot hear you. Now I can hear you.
Okay. Angela, did you hear Lori Roosevelt wants to know about reimbursement funds? Are they still available, or we have to wait till this COVID-19 lockdown ends? And what fiscal year do we have to have the receipts in?
Loud and
Yes, I
clear.
can hear you, Angela.
Oh my God, this unmuting and stuff is really, okay.
We understand.
Yeah,
Reimbursement
the
is
same
still
thing happened
going on.
to me.
Yeah, it's stressful. I've hit this button like 10 times.
Well, the only thing
Wow.
is you don't have to if you don't have to mute right now because I know that's
No,
very,
but I was trying to answer the question and
I know.
unmute, and it wasn't unmuting, so it was, anyway. Lori, in order to answer Lori's question, reimbursement is still going on. I'm still processing reimbursements. And obviously, things are not going to be done like yesterday. It's going to take a couple more days, but they're still being processed. What was your question about COVID, Deborah?
The fiscal, no, in reference, because normally when we do the reimbursement, receipts have to be in with the correct fiscal year for New York City, July 1st to June 30th. So one know was
Oh,
there,
that's not changed. Everything is still the same.
that's what I was asking. Okay,
Nothing has changed.
thank you. I appreciate you answering that, because
It's taken a little longer to get stuff processed because, they have to have meetings. They have to do their meetings safely before they submit stuff to me to review.
okay,
okay.
thank you.
Pat Lou said he already answered the question. Okay. Stop. I see.
Thank you, Angela.
Okay.
You're welcome.
Thank you, Angela. Sharon Shields, you're the last question. Do you have a question?
No.
I'm guessing not now. Okay. Does anyone else have any other ones have questions for Eileen? Because
And Angela.
Pat, do you have a question now? Because now you're writing something to me, and I can see it from the big screen. I cannot hear
Can
anyone.
family be reimbursed for tablet or any other device for them to get on their virtual meetings from program? Angela, did you hear what I said?
No, what is your question?
All right, this is from Pat Lowe. She wants to know, can family be reimbursed for tablet or any other devices?
No, we're not reimbursing for tablets or iPads. The Department of Ed is supplying those, and we are not paying for them.
What about if the person is an adult?
We are not paying for them.
They're not? Thank you. I was just getting clarification.
Okay. Well, we need to move
We
on.
are not paying for any iPads, any computers, or anything like this during COVID. Nothing has changed.
Okay.
Okay. Thank you, Angela and Eileen. Joyce, we're going to have to move on because the 2020 censors.
I have the other question from Sharon Shields, quickly. Do children have to be tested before they go back to Dayhab? Or
Do children have to do what?
be tested to see they're COVID-19 virus free before going into Dayhab?
I would imagine, as with anybody else, they should be tested.
Okay.
You don't want to send someone to Dayhab that has the virus and then it spreads throughout the whole facility.
Agreed.
I agree.
Right, Angela, it's Joyce. I would say also the guidelines are still being worked out between OPWDD and the providers. And there's been no guidelines that have come out yet. So just hang on, right?
Yeah, I would just say as a safety precaution, you would do that anyway, but.
Right. Exactly.
At this time, right now, I gotta get the speakers to speak because they got ready. So I want to thank Eileen and Angela for both being here today for this tough moment. Right now, Miss Golden is getting ready. She's ready to speak. If anyone else has additional questions, can email, Angela's email, which is angela.blades. And as it's already on with Henry's email, it's already on the chat, or email Eileen. But as
okay, no problem.
And Chris, I'm going to get back to you on the CCO follow-up question. I just sent an email, so I'll get back to you.
That was Miss Golden.
All right, you guys have a good day and stay safe.
Thank you. You too.
Thanks, Angela.
Absolutely.
Both of you.
Okay.
Bye.
And thank you, Joyce, for chiming in when needed. Thank you so much.
No problem. Take care.
Thank you, Joyce.
Bye.
Ms. Golden, can you take it off the screen for 1 second? Because I got to introduce you first, and then we'll start you first. And then Jonathan will be right behind you.
Okay, sounds good.
Can you just get off the screen for 1 second?
Yeah.
I need to give everyone a chance to mute because I don't want everyone to hear you.
Okay.
It's, yeah. Thank you. First of all, I want to thank everyone. I know Eileen and Angela have been very busy, really busy, but today we have two speakers. One is 2020 Census, Ms. Golden. You might recognize her from the Queens DD Council. She was at the Queens DD Council last year. This year, she actually gave us lots of good information during the CCO. And she's here today. And also Jonathan Nowak from the Mayor's Office of Disability, who's been doing fantastic outreach, which he'll speak. So what we're going to do is let them speak, both of them speak for 6 minutes. Then you guys can answer any questions. If you have a question by phone, please say your name so I know who you are. Everyone right now, I'm going to mute you. If you're on the video, please mute and listen very closely because this information can change our disability population. So please, everyone, thank you. Go ahead, Ms. Golden. I'm muting everyone. 1 second.
Hi, everyone, and thank you so much for joining us today. I'm Jolie Golden. I'm a partnership specialist with the U.S. Census Bureau, and I'm going to share some information. I want to thank first Chris for continuing to invite me on different calls that reach stakeholders within the community that serves the disabled and people who are disabled. It is incredibly, incredibly important. So we are in the midst of counting everyone once, only once, and in the right place. And when I say everyone, I mean everyone who lives in every household, documented or undocumented. The roommates, the people who are staying temporarily, we are counting them all. 330 million people in 140 million households. With the pandemic, some of our operations have been compromised. So we are not going in the field as quickly as we were supposed to. For those of you who want to know the last time that you can respond to the 2020 census on your own, self-response is the best way to respond. You can respond until October 31st. However, we will be sending people out in the field to knock on doors, wonderfully trained enumerator, census-taking staff, and that will happen starting August 11th. So if you are interested in making sure that no one knocks on your door, it's really important that you and your clients fill out the 2020 census by late July, early August, because we will start moving our census response representatives out into the field. I'm here I want to show you a little bit about response rates, but first, I want to make sure everyone knows how easy it is to respond online. This is the most accessible census yet. It is by far more accessible. There are phone numbers people can call. People can respond online. People can respond by mail. If you look here on the website, this is by far the first choice of people in the United States to respond to the census. Of the 59.6% of the nation that has responded, nearly over 45% are responding by the internet. You click here to respond, and then you can translate into any of these languages. It's super cool. So if I click on Spanish, all of a sudden it comes up in Spanish. If I click Portuguese, it comes up in Portuguese. Back to English though. Once you start the questionnaire, we mailed everybody a 9-digit ID number. If you don't have that number or your client doesn't have it, don't worry. You can fill it out right here by clicking if you do not have a census ID and putting in the address. It's super easy and it's super important. because this is going to determine, I heard someone before asking, are we going to get all our funding? Well, if you want your funding for the next 10 years, you need to respond to the census and encourage everyone you know and everyone you can reach to do the same, because the census counts in each state will determine the division of $675 billion in federal funding for everything from Head Start and Title I for schools to programs for the disabled. All federal funding relies on this formula, and it is based on the Constitution. Your representation in the U.S. House of Representatives, same thing, is based on the count. So let's see a little bit of how New York is doing. Clearly, you know, the fact that the pandemic hit right after March, right on or about March 12th, when our self-response opened for business, was not a piece of good luck, but we are doing the absolute best we can to reach everyone. So if you look, sorry, I'm skipping around here. All right. If we go here on the census website, it's easy to get. If I start here and I'm at get the facts and response rates, I'll get to our response rate map, which I've actually pulled up right here. Super handy. And what you see is response rates by state. You can click on the state, and that'll get you to New York, which shows that we are at 54.3%, right? New Yorkers, we're winners. Like, we want to be ahead. We want to be better than this. So Chris has been helping spread the word, but anything that I can do to help your agency, whether it's sending materials, whether it's doing a webinar like this with social work and other staff, we are ready to be helpful. In terms of, oh, there's the Bronx. In terms of Brooklyn, if you want to know specifically, let's say you want to know, how your area is doing. All of these little Lego bricks are census tracts, and you can see what the response rate is. I happen to work with some areas in Brooklyn and Borough Park, and I know that this is a neighborhood that serves the Hasidic community, and they tend to respond by paper. So when I look at the response rate, it's 34.7%, which we are desperately trying to increase. The internet response is only 15.6. If I go over here, you see that the total response is 61.7, the internet response is 53.4. That's much more typical. So that's a little bit of what I wanted to share with you today. I hope that everyone knows how important the census is. It only happens every 10 years. And I am very happy to take questions, either by the chat or Chris, do you want to moderate any questions?
We're going to hold on to your questions after Jonathan Nowak speaks, because it'll be easier. Because as I said, both of you will speak for 6 minutes to give, proper information, and then you guys can give the answer to anyone has questions. Because I already know 3 people have questions, but they know they're going to wait till Mopat finishes.
Okay.
All right. But,
yep.
I'll say this, it is important to everyone to really get the 2020 census in. Debbie has additional, and by the way, Joanne, thank you for sending us something that actually might change a lot of things in the future. Is Jonathan here?
I am here. Hello.
Okay, as everyone knows, first of all, Ms. Golden, can you take us off the screen for a second so I can see? Sorry.
No worries. Hold on.
No, actually, I like it, but save that page for later in case someone has a question. First of all, I want to introduce Jonathan Nowak. As you know, he's still handsome, which I can brag. Jonathan is a very powerful outreach information, and I know Carrie can vouch with me. Half of us can vouch that. He gives more information than FEMA.
Yes, you do, Jonathan.
Okay. Let me, because we got a time. I know everyone's bragging about it. That's why you see I have to calm her down. She's so excited when you're on. It's a joke. The main thing is Jonathan is going to give you some really good information. So I want everyone to listen to what he's saying to you. Write it down. If you have a question for him, chat on away. Jonathan, you're on.
Sure thing. Hi, everyone. Hello, Chris. Deborah, thank you so much for having me. My name is Jonathan Novick, and I'm the Outreach Manager for the Mayor's Office for People with Disabilities. Quick summary about our office. The Mayor's Office for People with Disabilities, our main goal is to work to ensure people with disabilities have equal access to everything that New York City has to offer. During, traditional times, pre-COVID, what we call blue skies, that is access to accessible transportation, housing, benefits, employment, and, fun things that New York City has to offer as well. Broadway shows, New York City parks, our museums, our cultural institutions, and things like that. But of course, with COVID, with everything that's been happening with our city, we've been taking that mission of ensuring access, of trying to represent the needs of the disability community and applying it to COVID response, and, ensuring that resources are being created for people with disabilities that are inclusive of people with disabilities, and trying to get a handle on where the needs of the community are, where they lie, and what we can do to help amplify that message, and where we can, connect folks to resources when possible. So I just want to open up and say that, if you are a person with a disability, or if you work with individuals within the disability community, and you have questions or concerns about COVID-19 response as it relates to people with disabilities, please do not hesitate to reach out to our office. You can do so in the following ways. You can call 212-788-2830. That's 212-788-2830. You can visit us online at nyc.gov/disability. That's nyc.gov/disability. Specifically in relation to our COVID-19 response, our office has created a disability-specific website that is full of resources and information regarding or centering around the needs of people with disabilities within the community. And that is available at nyc.gov/disability-coronavirus. That's nyc.gov/disability-coronavirus. And there you'll find some links to the latest coronavirus info on the Department of Health and Mental Hygiene website. You'll find information on food and supply delivery. New York City has, specifically emergency management and the food team, have done a lot to set up a food delivery program for people with disabilities, specifically centering around individuals who fall into a few different buckets. If you physically cannot leave your home, to go to any of the food pickup locations set up around the city. If you are not able to financially afford food delivery, there is a food delivery service that you can apply for by visiting nyc.gov/getfood. That's nyc.gov/getfood. And you can also learn more about the service by calling 311 or texting 311-692. And then once again, that's for food delivery or for any 311 service. If you're a person that maybe is hard of hearing or deaf, or you prefer to just text to get information, you can actually text 311 by texting 311-692. I apologize for going off on a few different tangents, but to close the loop on the website, food and delivery services, we have information on home health care providers, the latest information on transportation, housing, utilities. We have some information on tech programs for individuals who currently do not have a phone and are trying to receive a phone or internet for free or lower cost. We have expansive mental health resources, including NYC Well, which is offered by the city, starting from First Lady Charlene McRae's Thrive NYC Mental Health Initiative. But we also have mental health resources for folks who are deaf and prefer to communicate in ASL virtually. We have a whole list of accessible virtual activities. So there's a lot of information there. Once again, that link is nyc.gov/disability-coronavirus. Apologize, I have my window open and somebody wants to show off their engine. That's nyc.gov/disability-coronavirus. So that's a lot of the information we've been putting together, and we have been putting it together, this resource, we consider this like a living web page because we're constantly updating it as we come up with more resources and as the city comes up with more resources. But as Chris alluded to, we are doing a lot of outreach. We have a weekly Friday call at 1 p.m. with our disability community partners. These are both service providers within the disability community, independent living centers, disability-specific organizations, as well as our public and private partners who we work with on our employment program side. But every week we provide updates from emergency management, Department of Health and Mental Hygiene, HRA, and other, we call them, I guess, like guest speakers who were talking about something specific that either came up last week or is, developing in the news, and we want to know more resources and information. We just want to know what's available. And then we open it up to general questions. And based on those conversations, based on what's important, we try and use our website as a constant molding template for where individuals can find information and where they can find these resources. So with that being said, I'm happy to answer questions. Chris, I know you...
Yes, I have people that put in, type in, have questions. We have, Lori Rosenfeld was first, and then you. Okay, Lori Rosenfeld having a little problem with her phone. She has a question for you.
All right, no, it's really for the 2020 census. It's some of us parents have been finding it difficult to fill the form out because many of our children are biracial, or like I have permission to use my child. My son is both Hispanic and Jewish, so it's hard to fill it out on the census. Also, a lot of us parents are still upset. We're not blaming Uniscom, but we want to be able to list our child's disabilities too. And yes, Ms. Golden did send me information on how we can, but it'll be a lot of hard work so that maybe by the next census, somehow we can get that information in, but there are still other ways. But she just asked me to tell you that it was very frustrating for her, but she's not the only parent who has gone through that issue too. So what can you say, Miss Gold, would you please put her back so I can see her?
I'm here. So I'm sorry for any difficulties that anyone is finding in filling out the questionnaire. There are places where you can write in information, so that would be my suggestion, that you write in the information that is relevant for you and for your children. I realize that it sometimes cannot be easy to know that you can pick other and write those choices in, but you're probably better off writing it in if you feel strongly that you want to put down multiple options. In terms of adding questions to the census, it's a complex process. And I wanted everyone to know that we do ask questions related to people with disabilities. That's something that you can mark on in terms of the American Community Survey, which is a very long format survey that we do continually year-round, including during the census. So if anyone received a really long form, that was the American Community Survey. All of the forms for the census are only 10 questions, super short.
Okay, just one other question in reference to what you just said. The American, about that other survey, can that be sent to any of us?
It can't be sent to specific people. It's a random sampling of the population across the United States. So it does give us good indicators regarding the number nationally of people with disabilities.
And can we redo the census if we want to?
What you can do, if you have completed the form and you want to make changes, you can call the 844-330-2020 number. I put it in the chat. Okay. That's the best thing to do, is to call if you've already submitted the questionnaire.
Okay, thank you so much.
Okay,
Thank
we have a lot of questions. Pat Wu, you're next. Pat, you press the unmute button.
I can't read what she
If
said.
someone from GHO here, can someone get
All
to
right,
Pat?
just let me see. What's her question?
And that's the thing. I don't know because everyone else has gone into questions too. I think this is.
Oh, you know what? There's also some questions for Jonathan too.
Yeah.
Jonathan, they also want to know, is there going to be COVID-19 testing that it will be easier for people with disabilities to get, especially this population has developmental disabilities, and as you know, not everybody is comfortable being tested. Do you know if they're starting to have new ways to test our individuals without, in a way that's safe?
So I will say that, let me see. Give me 1 second. Okay, so there are more testing sites popping up as time goes on. If you've been watching the mayor, you've been seeing that there's more testing announcements. Initially, they started in the most impacted areas. At the moment, all of the testing locations are walk-in. So if you are interested in finding out your closest testing site, you can visit nyc.gov/COVID testing. That's nyc.gov/COVID testing. You can also either call 311 or text 311-692. Once again, that's call 311 or text 311-692 to determine your closest testing location. As far as development in the testing, what that looks like, this is a conversation we have been having with the community on our Friday calls. Questions like, is it possible for somebody to get tested in their home? At the moment, the answer to that is no. They're focusing on the testing sites for those really heavily impacted areas. And right now, I'm specifically speaking about the health and hospitals testing sites that are popping up. You might see other private hospitals putting up different testing information, which I can't speak to, different hospital circuits. But as far as the health and hospitals go and that free testing, you can find out your closest testing site, but we have been in conversation with them, and I can assure you that the testing site is physically accessible, that they understand the needs of different individuals with communication who might require some kinds of accommodations centered around communication, such as folks who are deaf or hard of hearing who might require interpretation or some kind of video interpretation. But beyond that, there has not been any major changes to the testing. But I would say that if you have more specific concerns about testing, I'd be interested in hearing them. So feel free to send me an email. Chris, feel free to send my email, or I can put it in the chat.
Actually, Jonathan, I'm sorry to interrupt, but actually, can you retype your chat thing as well as Ms. Golden? Can you both type it up, your email as well as your phone number? Because somebody asking that question. And additional, Jonathan, you have your weekly meetings every Friday. Can you send that link information as well?
Sure.
Oh, and while you're doing that, I'm going to, the other question is, you see, YI, HeartShare, and a few of the others, and if I don't mention your agency, I apologize. I'm doing this for time. They also have clinics geared for people with developmental disability. So is there a way that the mayor's office, a person with disability, we can put everybody together so that also we can help our population? Because you see, Jonathan, when some of our children go and don't have the patience or get scared and start acting out, not every staff person at the other sites are understanding or know how to work with our children. So that's our biggest concern. So that's why I'm bringing this up, because yes, my child can practically stay still, but he cannot handle waiting either. So that's our problem. So can you, that's part of it. And I will get you more information on many of the issues we have.
Matthew, you have a question?
I don't have any specific questions. I have been writing in the chat that as of June 1st, Premier Healthcare will have antibody testing at our sites, except for the Bronx. So, for Brooklyn, we have sites at Remsen Street and Nostrand Avenue. We will have antibody testing. Just call the scheduling hotline at 212-273-6272. Once again, 212-273-6272. Thank you.
Matthew, later we might have a question for you. We'll
Yeah,
save
sure.
that question for later, but I want to focus. I just want to clarify. I know Miss Golden has to leave because she's ultra mega busy. So I'm going to repeat this again. If you have if you're having problems with the 2020 sensors and you want her to come back, we can always set up the video chat between next month's meeting, if we have a meeting, which I'm saying if, because I can't answer for the DD right now. But before you go, Joyce, do you have any questions? Joyce? Oh, okay.
Sorry, I was, Chris?
Yes?
Yes.
Yeah, no, I was on mute. I'm sorry.
Okay.
On my own mute. No, this was very helpful, and I thank them both very much for their presentation.
Mm-hmm. And Ms. Golden, if there's any problems, how come I can't hear you?
Remove mute.
I can't hear you because I thought I heard your voice. You're muting. You're not on my side, it's on your side.
No, I'm good. I just wanted to say thank you very much for all these opportunities, Chris, and for the reach in this incredibly important community. And I hope that everyone's filling out the 2020 census. You can do it right now if you haven't done it already. And I look forward to further contact and to any questions. I left my name and phone number. Thank you, and very nice to meet everyone. Thank you, Jonathan, for all of your information as well.
Thank you very much, Ms. Golden.
Thank you.
Deborah Garrett, the chair of the advisory.
And Joyce?
Is from
I said thank you.
Yes.
And Joyce is from the DD Council.
Where's Matthew? Where's Jonathan?
Jonathan's, I just had Jonathan. Where did he disappear? Jonathan Nowak, you still
Are you
with
there?
me?
Yeah, I'm here.
Okay.
Oh, there you are.
Jonathan, stay with us because we're going to add something later on one of the reports.
If you can.
Yeah, I need to jump off at 11, but I'm here until.
All right,
then ask him right now.
No. It's okay. Let Jonathan.
Jonathan, if you have to leave, we will type it up the email for you. Also, if anybody has questions for Jonathan or as well as Ms. Golden, beware, we do have a lot of their information on the Advisory Council's website, but if you have direct questions, we will help you get their email to you and make sure that you get your questions answered. So I want to thank both Jonathan Nowak from the Mayor's Office of Persons with Disability, you are the community outreach person. Also, everybody, you can go on his Friday, it's from 1 to 2. And I will tell you, it does help us because we do get a lot of these social service agencies like Medicaid, HRA, example, on the call. So when on video. So when we have issues or problems, we can bring it up to them. And that's how a lot of other things have been changed or improved, because we all opened up our voices to tell them what problems we had. So again, I want to thank you both.
Okay, right now we're up to chairperson. Since we already did the DR report, it's Joyce, your report.
Okay, thank you, Chris. Thank you, everybody, for joining, and I hope everybody's doing well during this time. There really is not a lot to report. We are working across agencies with IAC on trying to redevelop and reimagine the day programs, how they'll look once we can return safely, from transportation all the way to how many people can safely be at a location, can we continue to have a location. Everything's on the table at this point because we don't know how things are going to look. But I do want to make everybody aware that as you hear the governor, the budget is very bad. If you listen to the governor's speech, if we do not get this stimulus money, it's going to be very bad. We're looking at cuts to OPWDD. I urge everybody to go on. New York City Fair is going to have an update. Debbie, if you can send them the information. This will be, I think it's Tuesday or Thursday. And then they will also send out occasionally things for people to contact your local congressman, your local Senate people, to urge them to vote for the stimulus package, because without that, we're really, really in trouble. And in my 40 years in my career, I would never even think we'd be at the point where we are now. I was there when Willowbrook closed, so I get it. Um, and I never thought we'd be back in the situation we're in 40 years later. But it's pretty scary, and everybody should start to think and also, again, contact local congressmen and be on the alert. In terms of transition for people on the call who might have, is Mary Christopher on the call? No, okay.
No, she has not
for people,
responded back.
for people who have people aging out, I'm talking about 21-year-olds going to the next step. I know that District 75, some of the schools have set up virtual screenings for day programs. I urge the families to take advantage of that. Also, please be aware that you must ensure your child meets the eligibility criteria, and working with the CCO to fill out, do the front door. There are front door virtual meetings going on. There are agencies providing virtual psychosocials and in-person psychological testing. Chris, we could put out information about that, about agencies doing both.
That's on our website, Joyce.
Okay. Okay. So
will,
then if anybody needs to take advantage of that, please follow up and make those calls, because that eligibility criteria is key. Everybody must meet eligibility or they cannot get services. Right now, day habs are providing virtual services to people that live at home, to the individuals that live at home. So there's no reason why that can't continue if once your child ages out. We've also asked OPWDD and State Ed to allow people to stay extra time with the Board of Ed. Although the letter was written by the 5 council chairs and sent, we have not heard back. I think that's pie in the sky for that to happen, but that is a possibility that we're looking at as well. So I don't want to sound all doom and gloom, but we really have to work together and get that stimulus money. Any questions so far? Chris, any questions?
Does anyone has any questions for Joyce? I guess not. I'm surprised.
Joyce, this is Debbie. Okay, I want to first of all, as your counterpart doing the advisory council, I did live through Willowbrook. Yes, I was a child. I acknowledge that, but I know what happened there, and I don't want our service system to go back there. So I agree with Joyce 100%. The advisory council, we're asking everyone to write individually to your local congressman, your local, not just only your congressman, and I'll tell you why I'm saying this. Many of them, to save money in New York City, share offices. So if your assembly person, a state senator, and New York City councilman person are sharing, you have a letter for each of them too, so they all know how important our services are, the funding that's needed. In reference, please let United States Senator Charles Schumer know, and definitely let United States Senator Christian Gillibrand. We have to. This is also an election year for the state assembly and Senate, but presidential. I am not telling anyone to be Republican or Democrat. Please hear what I'm saying. Need to put pressure on the Republican, whether it's the local or statewide Democrat and Republican Party. We need to put pressure on them, because they keep forgetting that people with disabilities, whether it's developmental or not, we're a big voting bloc. And they need to know that if they want us to vote for them, they need to make sure that our system of OPWDD with the agencies work, that have the funding so the programs can continue in the safest way possible. Also, I know the Interagency Council working with New York City Fairs, we've been advocating all together, but please, whatever Joyce said, she's 100% correct. We all have to let them know how it will affect you if there's no OPWDD services. It means you can't go to work, and what will happen to your child's socialization. Those are some examples. So what Joyce said was 100,000,000% correct.
And I think you mentioned, because some of the questions today, just to add in with Debbie, with the advisory, as well as the CCO had their meeting last week. What's wrong? Don't worry about looking at that. Working on this.
Sorry.
Focus. What we're saying is Rose Sal was supposed to be here today, but she's stuck in emergency meetings. This is something that Joyce and Debbie are both saying. We are hearing the same thing with the 3 CCOs. We hear you guys, but at this time also, we're asking all of you to please, let's work together on this time of need right now. We need everyone to definitely contact our elected officials. I know there's some on, and I know they're hearing us, but at the same time also, we need you guys to call them, email them.
Social media them,
Yeah.
That means Facebook, Twitter, Instagram,
Facebook,
anything. And the only thing is, yes, I'm probably right to be upset, but at the same time, we get more things with honey than with vinegar. Let them know, because they need to know how much money our population brings to the welfare of New York State.
Joyce, you want to add anything?
No. I mean, it's all, basically what we've been saying. Do you want to tell us about the meeting that Rose had?
We actually.
Yes, we will.
Well, actually, just to add one thing, Joyce, some of it you actually are talking about, and Debbie is talking about. It's similar to the same issue, but there was a couple of good things we'll say. Debbie,
one thing that was very positive is that a lot of I want to thank all 3 care coordination organization and PHP for participating, and they're trying to make sure the paperwork is filled up for the family so they can at least get them ready for services. They've been noting how difficult it's been with the children not being able to go out to their day program or to the other programs that they use. It's very hard, and they agreed that we all have to work together as a team to make sure that the services stay. So is it scary for us? Yes, we all agreed at that meeting it was scary. We've agreed we're going to work together. We did hear the issues, and their biggest issues is it's not always easy to do things either by phone or virtual, because of sometimes you miss a word or two. But they have assured us they're still working very hard to keep their agencies, the CCOs, running so that our families will still continue to get services from OPWDD as much as we can possibly get. So we did have the meeting, Rose and I, it was very productive. So we will let you know if we're having another one.
One thing that Deborah did forget, and by mistake, I also forgotten as well. During this coronavirus, we have lost 2 people, very legends, did not get the COVID-19. So I want to make that clear for the record. So we want to make that clear. One was in Brooklyn was Calvin Fischetti, our legendary. He did not die of the coronavirus. He died on his Parkinson.
He died from Parkinson, but we did lose one of our parents from the COVID-19. That is Mrs. Sandra Gilmore, who was the 2nd vice chair years ago. Sad to say, she didn't make it. She passed away from COVID-19. She's the only parent at the moment that I know. Also, in the Bronx, one of the founding parents, also the way the Shetties were, Mary Bonsieur. Excuse me a second.
She passed away as well.
Not from Corona.
Not from coronavirus. And,
So,
excuse me. Debbie's got things in the wrong pipe. Unfortunately.
Sorry, throat.
All right. The main thing is we have lost 2 legends. So before we continue, just like to have a few minutes of silence for our 2 legends first. And some are a lot of individuals and maybe some staff and staffs. So we're asking everyone to please mute yourself and please do a few minutes of silence for those.
1 minute of silence.
Thank you.
Thank you.
That is from Rose's report. You know, she does not mean to the summer, so she says happy summer to everyone. Joyce, just to let you know, her attendance for that meeting is gotten stronger, and I have to say the CCO meeting worked very well.
Oh, good. Very good.
We also had the 2020 census. She was there as well and did give a good presentation, and people had questions, and I have to say that even today, I have to say it is important to everyone, which I'll show everyone in my report in just a minute, but Rose CCO meeting will continue. I think, Joyce, you agree with me at this time, the CCO meeting will continue in the fall.
Okay. That's important.
Huh? Yes. I'm sorry, because 2 people talking. Can you repeat that again? Joyce, can you repeat that?
Oh, I said, no, that's important that continues.
Mm-hmm.
Also, I did get from Ms. Golden from the United States Census, how do we get the disability community listed with questions on the census? We're still reading the report. It will be shared, of course, with
it will be
Joyce. It will soon be available. We'll put it up on the website, because it's not just me taking the lead. All of us have to take the lead in this. Mm-hmm. We all have to work together, because the important things is to remember, our children may have a developmental disability, and we can have a different form of disability. Mm-hmm. We need to have people with disabilities always counted, and so that they know the need. So if we can get that information and work together, I don't know how many work groups go together, we eventually get them to count us.
All right. Does anyone have questions between Joyce's report, Deborah's report, as well as CCO report? I have to say, this is the first meeting I've been on video conference. It's so quiet. And I'm saying that for the record, because I've been on video conferences a lot. And I have to say, you guys are the most quietest people ever. But Carrie Banks, you wrote something to me. Do you have a question for us? Carrie Banks, I know you're there. Carrie?
Well, the library is still working.
Hold on.
Are you there?
Yeah, I'm here. Sorry about that. I had trouble unmuting.
Okay.
No, I did not have a question this time. Sorry. I put some information in the chat about virtual programs for individuals with disabilities and for people working with individuals with disabilities. We are continuing our one-to-one navigating disability systems programs virtually by phone, because we know a lot of people don't have access to iPads, Wi-Fi, internet computers like that. So there's the phone number there to call, and that's 917-751-4890. It's in the chat box. That's the program that we do in partnership with Include NYC. We had some great questions last month, and we're looking forward to this month's program on June 3rd. And we are supporting Music for Autism's regular autism-friendly concerts.
Carrie, this is we're going to hold on to announcements.
Okay, sorry. I have to go, by the way. I can only be a few minutes, so
finish, Carrie.
That was it. I was in my last sentence.
No,
we have autism-friendly concerts every other week. And if you go onto our Facebook page or website, you can find the information for those.
Oh, so I have the question for you, and they're
Yes.
super quick. You can also, as long as you have a Brooklyn Library card, you can go online to even get books or, now I know it's books to read. So they also have the videos or DVDs that you can check online?
Yes, you can borrow books and ebooks and audiobooks. You can download music. You can stream videos. You can get career advice. We're doing a lot of programs. In addition to the basic borrowing of our basic materials, we're doing a lot of programs virtually. We have shifted much of our collections money to buying virtual books, of course, and other online content that might be helpful for people. If you have a school-age student, you can, and no access to the internet, we have mobile Wi-Fi hotspots that you can borrow. And of course, we have Wi-Fi is still going on at our libraries. If you need an internet access and have no other way to get it, you can bring your device to outside the library and you should be able to connect.
I'm glad you said that, Carrie, because now you just made me feel better, what you just said.
Thank you, Carrie, for that.
Because I actually said that already to someone a few days ago.
Oh, yeah.
Told me was wrong.
And someone told me I was wrong, so now I can have fun to do to someone saying, I'm not listening to you people.
No, you're absolutely right. And we are, of course, looking towards reopening as soon as possible. Library service will not look initially the same as it's looked before, but we will, we are looking at a tiered system, like many of the rest of you, a tiered system of reopening, starting with being able to pick up books at brick and mortar locations.
Carrie, can you stay on just a minute, because you're part of.
I can give you about 6-7 more minutes.
That's all I need from you, because you're one of the pieces I need, because we are talking how to keep people busy. It's part of my report.
Okay.
Joyce, I'm going right to my report so I can speed up.
Okay, Chris, no problem.
Okay, because I need Carrie, the one of all.
Not going anywhere.
First of all, let me make this clear to everyone who's on the video. So everyone who's on video or on by phone. First of all, I want to thank a lot of you guys, and I want to thank everyone else, because I'm going to share this in 2 ways, because this information I'm giving you is very important. As you know, this is the Advisory Council website. And I'm going to click enter for a important reason, because Carrie is one of my piece of my puzzle. And the other 2 speakers were also part of my other puzzles. And some of you are part of my puzzle as well as a lot of the agencies. As you know, this is something that we had to create immediately because people need information. Carrie is part of one of the categories called well, it's actually more words to it that's shortened here. How to keep yourself busy. So what are we saying to everyone? There are ways of keeping yourself busy. As Carrie just gave a good piece of it about the library, because you can go on to the library.
Yay.
Yes, Carrie is one of them, because we want to make sure kids are keeping themselves busy and learn different things, because this Corona-19 is going to change a lot of people's lives. And maybe also we need to make clear to everyone that how to teach kids to stay healthy, how to stay clean, how to wash your hands, do some different games, how to wash your hands, like challenge someone. It's been going a lot. If I go on these pages, we'll be here until next year. As Joyce mentioned earlier also, but also before I do Joyce, Carrie, Include Library is also linked, as well as the main public library and the New York Library are both linked to our websites. And it's also linked to the Mayor's Office with Disability. So as Jonathan shares your information like toilet paper, which I can say because somebody else said it before me, it is important that we all make sure this information goes out to the families, even you at the agency. It's good to share. It doesn't matter if you're in Brooklyn, Manhattan. It doesn't matter if you're in upstate New York or Long Island. It doesn't matter. Keep someone busy, and it's easy to get on. There you go. Get on our website. You can also do it by your phone, which it does work 100%, because I have tested it myself, and I can vouch 2 other ZEC board members and 90% of parents in another borough. So I have not heard any issues with any wrong with our website. So if something goes wrong, let us know. But the website is available here. Carrie's information is definitely in how to keep yourself busy. Mayor's office, as Jonathan mentioned, is also here. Now, Carrie mentioned about Wi-Fi, and I'm going to use part of her brainstorm her. There is free Wi-Fi access to do it. It doesn't matter if your child is in school right now. This information we're sharing with you is important. You can go onto the MOPAD page and click on how to sign up for the free Wi-Fi. We know a fact that some of our exec board members and parents have gotten the free Wi-Fi. Good. In 16 ways. Thanks to Jonathan, Mayor's Office of Disability, has got that. It even has how to get free pet food stuff, how to get all the information. So when Jonathan updates the website, we update as well automatically. So get to know our website. And yes, updating, like example, where Matthew mentioned earlier, or Joyce mentioned earlier, that's added in every 1 week. So like say, Carrie, you have an event coming up.
Yep.
It gives me time to put it on the website, so it gets the families to know there are different entertainments you can watch, or different ways of how to keep yourself busy. Thanks to also Special Olympics, they're also doing some tips how to keep yourself loose at home, or do proper outside stuff when you're in a area like you need to get outside and get some fresh air. Like today's weather is nice. Get a chance to go outside. Yes, you might have to wear a mask, but, and I'm going to take this off for a second so people can see my face. There are ways also on our website you can make your own mask to make sure you can breathe. Now, why are you tapping?
Nothing.
Okay.
Go on.
Tapping. The mask is so there are different ways. You know, a lot of our individuals do a lot of art. This is another way of doing how to make your mask by art. And I have seen this everywhere in the United States. And I see starting in New York, it's starting to do that too. There's ways of doing how to make your own mask, make it colorful, make it beautiful. And if, say, you want to feel comfortable with your mask, there you go. Now, there is one procedure, health procedure, I like to remind everyone. If you're a person with, can I have your phone? Yeah. There is some health procedures that not just the governor mentioned, but I want to thank Jonathan Nowak. I know he said it for me. Like, if you're a person who has trouble breathing, like if you're
asthma, bronchitis, yes, that's my pump,
which I'm holding in my hand. There are certain procedures. You can lower the mask, which my hand is using as a mask, lower it down to your mouth so you can breathe, because some people, the nose is a much easier issue, which you can understand. Or if you cannot breathe at all, you don't have to wear the mask, but you'll have this in your hand. So please make sure you have an asthma pump or something something to protect. If you don't have that, there are other ways of substituting, but try to also not to go into big crowd areas.
If possible.
If possible. But if you have to, I suggest make sure you have hand sanitizer, which is available. And I know, in fact, Walgreens has it, but they're not selling like a whole kitchen sink. So let's easy down with everyone. Hand sanitizer should be used outside, not in your home. You have soap, you have water, use it. And be careful, too. Teach them different skills. You know, it's always good to learn different skills on this. Now, I want to get back onto a different, first of all, I want to thank Carrie Banks because she has sent us.
Thank you very much, Carrie. Both councils appreciate all the help you've been giving to our families.
Yeah,
and we thank you.
I want to get this point here. So I'm going to click the share button again because this is very important, because now we have to be concerned about our early intervention children and young up to teens, and why I'm having the screen on for a very important reason, which I'm going to switch it down to here. The Advisory Council, since this coronavirus started, we've been doing special reports, and now I'm changing it. Well, it was changed to YouTube to do updates. Normally, I do updates during today around 9 o'clock in the morning, but due to the fact we have our joint meeting, we're doing today by Thursday, we're doing another update, which is Thursday the 21st, live on the YouTube page at 9 a.m. Our topic is how to keep our kids healthy and safe, because there are some individuals. Yes. Yes, but the thing is to keep them healthy. We will be live on YouTube at 9 o'clock. You can click on it. If you didn't get that email yet, let me know. Or look on our website, which is available on our website. So therefore, it is available there, and it will be on at 9 o'clock. Now, any health providers who are available wants to speak as well can email me, and I will send you the code. And I'm going to ask everyone. We're not going to be doing this like the whole time, because we know that at a certain time we want to make sure that everyone has to go on their regular business. But we want to make clear that our young individuals and early interventions are staying healthy. One thing that Jonathan maybe was going to save it for us, but I knew he had to run because of emergencies, meetings, and everything. Make sure you keep communication with your medical doctors. If you're going to go get tested, let your medical doctor know. It's very important to let them know at this time as well. Main other thing is another safety thing I want to add in is this is for every agency and everyone. As you know, MTA buses, there's been complaints. A lot of the families have contacted me or contacted the MTA. I have been traveling a lot of the boroughs, yes, with a mask on, and don't worry, I'm fine. I've been tested 17 times already, or I'm just making up the 17. It's really 6 times. There is procedures with the buses. If a person is in a walker, wheelchair, cane, mobile devices, they are allowed to access the front, and you must be near the bus pole. If the driver refuses you on, don't even say anything. Just say, duty noted. In front of the bus, you get the vehicle number. The bus stop has the name of the street between the 2 cross streets. Make sure you write that down. Direction of the bus can be going towards Jamaica bound or Broadway Junction bound, or those directions. Make sure you know which way it's going. And please make sure you write a short sentence. The short sentence means the driver did not let me on. I'm a person with a disability. I have a walker, or I have a cane, or I have trouble getting on the bus from the back. Make sure you also keep, if any of your families or individuals have a half-day or senior card, should be wearing around their neck. Because as you've been seeing the incidents with the NYPD, they have not started with any of our populations yet, thank God, but we do need to make sure that we follow that procedure around your neck. I always wear mine. I have that a lot of our individuals and people with disabilities have. So I'm encouraging you all to please make sure. One thing is once you follow that complaint, you have 2 ways of doing it. And I'm going to email, it's here as well. It's called accessibility@nyct.com, which is the MTA to accessibility to the MTA. They will investigate it, or if I have to come out to check it. Or you can also send it to newmta.info/customer feedback. The customer feedback, when I just gave you the instructions, were your email address, your name, bus stop, which the name of the bus stop and the route, the bus vehicle, and the direction of the bus. And I said this before, a short sentence. If you want to take a picture, there is a way you can attach that picture between an email or by your, or as well as, I know I'm getting texts up crazy. This information, it will be investigated as soon as possible. So I encourage everyone to please, guys, make sure your fellow people are safe and getting the necessary help. So anyone have any questions about this? Go ahead. I know someone just read to me.
Okay, in reference to the bus, can the person with the, can the person who has a disability and if their child is traveling with them, can they go on the front with them?
No, unless it's a wheelchair.
What happens if the person needs assistance because they're a little wobbly?
You better have a cane, as I said.
No, the person has the disability, their aid, which can be used as your child can be your aid or help you. Can they go up front and help you on front and sit with you in the front?
I will say
we have to get that.
I have to say you have to be careful. Some drivers are not following that procedure. I can say yes, but there's some drivers will not follow that procedure. They're really pushing more of the wheelchairs to go on because they are more equipment, walkers. I know, Doris, you have a question. Thank you for putting that hand up. I'll with you in 1 minute. It's a difficult procedure, but I suggest you try it out with that bus, and you can explain he's your aide. But make sure you wear not those rubber gloves, wear those sports gloves, because the rubber gloves are supposed to be for the first responders, the care workers who are representing our individuals in group homes. So we're asking you guys to please check that out. Doris has a question, and she just took us off the camera. And I got you, Doris. You can speak. Doris, you just muted yourself, and you just took off your camera. Doris, lost you. I can hear you. Joyce, you have any questions?
Joyce isn't here.
Oh, okay. Joyce left us.
Joyce said, thank you very much. She
Okay.
wished everyone good luck.
Doris, if you're having trouble right now, oh, Joyce is still here.
No, I'm here. I just wanted to say thank you very much, Chris and Debbie, for setting everything up and keeping everybody so informed.
Mm-hmm.
You're really keeping it together in terms of sending out the information and letting us know. And, you know, I really, really appreciate it. So thank you.
Joyce, from Deborah Gripe and Christopher, it is our pleasure to help because we need to work. We are working together, and we know how important it is. And it's our pleasure to help you with whatever we can do for you. And we want to thank you for what you've been doing. Nobody realizes all those important things you do behind the scenes. So from every parent, we all say thank you.
I see.
Oh, thank you, Debbie. Thank you.
You're welcome.
And also, Joyce, do you have any questions on the report I mentioned?
No, everything's pretty clear.
Okay.
And we'll let everybody know for June, you know, when the next meeting will be. You know, we'll send something out. We'll do it jointly again, if that's okay.
Well, that's fine. That's fine. Well, one thing I don't know, Joyce, no, one thing, or I'll ask you when we talk separately.
That's private.
Okay, no problem.
If anyone, I see Dolores is back with us, so I see she's fixing herself. I can hear you, Dolores. You're off mute. You have
Joyce, is there anything else? Okay.
Hello?
Yes, I can hear you.
Yeah, I just wanted to say that NICEN is still accepting applications for reimbursement.
Dolores, hold on a second. We're not up to announcements yet.
Oh, okay.
Hold that thought. I was asking you a question.
Wasn't sure what you were up to. Okay.
No, that's the last part of the agenda. We're up to outreach report and giving you guys an update to make sure you know what to use right now as a weaponry. But hold that thought. But you don't have a question on my report or any other questions? I'll give you a chance to think. Sandy, you have any questions?
Oh,
I don't.
Yeah.
Okay, I heard no.
All right, this is, okay, before we start doing announcements, this is one, it's an announcement.
I can't hear you, Deborah.
Whenever you go out and you are using public transportation, and you know you have a disability using a cane or walk, whatever, and the driver does not let you on, doesn't let you on if you have an aide to assist you. What Christopher said about getting the information is very important, but let us know too. No, we can't fix the problems.
It's not just in Brooklyn, it's all 5 boroughs.
We want to know, are they really following the guidelines that the New York Transit Authority puts out for them? So we just want to know, and we will, of course, assist you with the complaint, but you have to start the complaint, and then we'll do it together.
Okay. Since no one else has any questions or they can ask me after, we're going to start doing the announcements time now. So I know because Dolores has been dying to do something. I know. And then Sandy, you have an announcement? Anyone has an announcement? Can you please just say, I have an announcement on the chatting? or if you're on the phone, just say your name. I have an announcement.
I have an announcement.
Yeah, I know you, Doris. I already said you, but thank you for testing it. That sounds good. Sandy, okay, we're going to start with Doris. Go ahead.
Hi, everybody. I hope everybody is staying safe and well. I just wanted to say my agency, New York State Institute on Disability, is still accepting applications for reimbursement. They're accepting applications for new testing. They're doing the evaluations virtually, and they're accepting applications now for the new fiscal year. And we're also accepting applications for our crisis intervention. And I sent you an email with our contact information, but anybody who needs an application, they can email me, Jen, nsidinc.org. O-R-G.
Doris, can you repeat that
And
again?
I hope everybody stays well.
Yeah. Say that one more time.
Email dnysidinc.org. They send me an email, I'll send them an application, and then you could forward it to the agency. We're still processing applications. And even, if camp's open, as you know, we give reimbursement for camp. We're waiting to see if camps are going to be reopening.
Well, we'll have to see.
Thank you.
We should be hearing, and I'll say this to add in what Dolores said. And Sandy, you'll be next, and then Joe will be right behind you. As I was saying this before, we will find out as you hear the governor, and also remind everyone, if you missed the governor, you can watch it on YouTube. And always, type it in. It is available on our advisory council group page as well, which I do put it on, so in case you miss it. So you can make sure that in case the press doesn't say something right, you can listen. Sandy, you have an announcement?
No, I don't. I think my colleagues may have. Well, no.
Okay, well, we'll see if the colleagues are around, but Joe? Joe?
Yes.
You have an announcement. Your name is here.
I typed into the chat a little earlier, but we have a contract with Care Design. We continue to assist Korean and Chinese speaking families to enroll into Care Design. If any families is considering transitioning and haven't start the OPWDD process, feel free to let us know. We could help them regardless of the language barrier. And also, for GXO, we still have openings for community help. They have webinar walls and support employment. If there's any concern, feel free to contact us as well. I will type in the phone number and my email on the chat box. Thank you.
Thank you, Joe. Okay. Oh, Joe, you sent me the information. Thank you. Well, I have to go everywhere around.
All right,
okay.
I have an announcement.
Hold on.
Matthew,
you
have an announcement.
Come on, let's get announcements in here.
I sent you the
vacancy. Speak it.
Say it.
Say it too.
I'd appreciate if you said it also. Thank you.
Yep.
So it refreshes everyone. Trust me. Can you please say your announcement? Agencies, if you have announcements, please please write on your chat. If you're on the phone, people, and you have an announcement you want to add, please say it. Say your name so I know who you are on the phone. Okay. Because right now we have 5 other people. I know Joyce is there. I can see Joyce, but there are 5 other callers. I don't know if they have an announcement. Okay, but Debbie has an announcement, then we'll go to Matthew, Pat, and if PHP has an announcement as well.
I'm announcing this, and it's not my policies, but when our mayor, de Blasio, makes announcements about who can get either a tablet or different things for free, be very careful what he says. Why? He announced anybody with disabilities Of course, he left out the part of it. You have to live in NYCHA, New York City Housing Authority, to get the free tablet, and you have to be a senior who lives in NYCHA. He's also said anybody can get it. No, is not true. Complaining for 311 is correct. And if you please let him know, because it will be very important for, and like, let the mayor's office of persons with disabilities make a complaint on 311. Because, as you heard, OPWDD, Angela Blake said clearly, they're not covering the tablets or the other devices. You need to, as I said, only the seniors and people who live in NYCHA are getting them temporarily. And also the only thing we're getting is, and you don't live in NYCHA, is 90 days free internet service. Okay?
Now, if any questions about that it was been Jonathan Nowak who did mention that earlier. He is investigating that issue. But if you need more clarification, Jonathan did leave his email address. You can email him and he will get back to you. I know there's been 2 or 3 people had sent me the information. We're still waiting for him to investigate this issue. Because as I said before, and Debbie has mentioned this 100 times, it's the mayor that is not communicating correctly. And that's why I say to you, listen to the governor more, because we're still in an executive order from New York. So I want to move on to, if anyone has any questions, can wait till after I finish the announcements. Let me see. Dolores already did it. Sandy has no announcement. Pat Lou, do you have an announcement? Or GHO?
Hello.
Good
morning, everyone. Pat Lou from GHO. As Joe says earlier, yes, GHO will continue to help individuals, especially they are aging out on border bed, seeking for adult service. We do have a job training program, a day program. We can assist them. So feel free to call me. My name is Pat Lou, and my phone number is 347-828-6660. Thank you.
Thank you, Pat.
You're welcome.
Yes.
Good morning. I have an announcement to make.
Please
Can you hear
identify
me?
yourself.
This is Danielle from Adapt Community Network, Danielle Raymond.
Oh, hi, Adele. You look different. No, I'm just kidding. Go ahead.
Hi, how are you?
Good.
I just want to let everybody know that we are still accepting applications for family reimbursement for our housing assistance program, our eMods, overnight respite, and our ComHab. If you guys would like more information, you can contact Project Connect at 1-877-827-2666, or you can email them at projectconnect@adaptcommunitynetwork.org. Thank you.
Okay, thank you. Anybody else?
You're welcome.
Mm-hmm. Okay, how about I already said that. I mean, PHP. Miss Sun, you have any?
Yes, thank you, Chris. It's Sunny from PHP. So PHP Partners Health Plan is also here to help the family to understand the right and the benefit if they're interested in enroll into a managed care plan. So anybody who is still eligible, 21 and older, and they can enroll, and it's totally voluntary. And if you would like to know what is the difference, what are the pros and cons, feel free to contact us. And I speak Chinese, both Mandarin and Cantonese as well. We also have other languages available for people to understand other languages. Feel free to call us, and my cell phone number is 347-213-8350. Thank you.
Thank you. Is there anybody else?
Okay, I'm going to use, I see cell phone people. Caller user 1, do you have an announcement, or please identify yourself? Anyone on the cell phone, please identify yourself. I know one person just did. I appreciate it. Sarah King, do you have an announcement? Or Fran? Anyone breathing?
Normal breathing. Okay.
Hold on, I heard a
Wait,
noise.
I hear somebody all the way up in the corner. I can see her.
Well, I can see it. Go ahead. It's not me. You're not. I'm not the one on.
Okay, unmute yourself if you. Okay,
because,
hi.
One second. I know who that is, but here's the thing. People on TV land, which is camera mode, video mode, you need to unmute. I don't have that control. You did it yourself. You double muted. Press the button again. Like I can hear Sandy. Thank you, Sandy.
Appreciate that.
Press the unmute button. There you go. I can say hello.
Hi, this is Daisha from GHO, Korean Outreach Coordinator. We do continue to assist Korean speaking families. I do. So any Korean speaking family intake for Care Design New York, I do, or we have opening for family support services. Thank you.
Thank you very much. Appreciate that.
And I also got to give some people confidence who put their hands up because I can see those in the big screen too. So I want to thank you everyone with that one. Nick, do you have an announcement? Because he's muted on his end.
Okay, you know what?
Hold on.
Do I hear something?
Nick, you can speak. Hello, Nick. Nick, you might be. Say that again. Guys, who have an announcements, can you please unmute right now? Everyone should be off mute right now so I can hear you, except Ann. Because she doesn't have an announcement, I know. Okay, I'm going to do my announcement because somebody's been asking me this question again. I'm going to repeat it. So I'm going to share this again back onto this screen. New York City Fairs is having a meeting this Thursday. You need to register. I don't know how they're doing the video conference. So if I was everyone's sake, you can visit our website. It's on the homepage as well. Scroll down and you will see this. Now, everything is copy and paste from New York City Fair, so I'm just copying what they said. So you can click on this blue button here to register. Automatically, this will activate it will activate you to register and send an email back at them. All I'm going to say is, if you have a complaint about New York City Fairs, saying it's not, how can they do the phone conference or log into a call detail coming by email next week, you can actually mention to them. All I know is you can click on register now, and it's on this Thursday, and it will start. Let me move up.
What time will it start?
It's supposed to start at 6. It's supposed to start at 7 p.m. So this gives you a chance to eat your dinner before the meeting on that. So that's my announcement on that.
And so if you have questions, try to send it before.
Yeah.
And don't be surprised if you don't have your question answered that day.
Okay. We have someone else asking me. Okay. Let me see. Who's raising their hand? Who's DAES?
Show a quirk.
Someone's.
Oh, I did already. I'm sorry, I announced.
Oh, that's
it's
you.
Daisha, I announced.
Yes.
Okay. I saw someone was getting on, and I just want to make clear.
Okay. I also just want everybody to remember the few things that I did say. If you hear anything you hear by Mayor de Blasio announcing things for people with disabilities, and you try to get it and no, it doesn't go through, please make the complaint through 311. And also, if you want, you can also complain to your other elected officials, your city council. You can complain to the controller, the public advocate, but also let the mayor's office of persons with disabilities, let Jonathan Nowak know, because he can straighten out a lot of messes. Because unfortunately, our mayor doesn't always listen to what he and says what he really should be.
Let me just make sure before we completely end the meeting. This will be a miracle ending early.
Lynn Decker.
Lynn Decker, do you have an announcement? Who is W.E.? Okay, Decker, you have an announcement?
On behalf of NYC Fair, that event Thursday night is going to be hosted on the Teams platform of Care Design, and it does have a call-in option. So you're registered just like anybody else, but it will support some call-in. If you have questions during the event, we're going to have instructions for you to email those questions, but you know you'll be participating by phone. You would be wise to submit your questions in advance.
Thank you. And also remind everyone.
Thank you very much, Lynn. Appreciate that.
Thank you, Lynn. Now remind everyone, as you know, you're on the phones during meetings and off meetings. Star 6 is one of the key buttons. Let me just check. Miss WDE, because some people put only their initial names. WDELEON. Do you have an announcement? Or Nick? Last call.
Hi, this is Wendy DeLeon. I do not have an announcement, but thank you for the opportunity.
You're welcome. And also, again, what Lynn said is very important. Get your questions in to New York City Fairs. In fact, when you get it, make sure, but don't expect certain answers, not because they don't want to. They may have to check before they answer.
Ms. Quad, you have your hands up. You will have an announcement for me?
Hello?
Let's see. Miss Quark, do you have an announcement? Because your hand is up. You have to.
No, I just cannot raise down.
Just ignore it.
Okay.
Okay.
Sorry.
It's okay.
No problem.
Nick, do you have any announcement? You're the last and final. Or Fran? You're off mute, so you can say. I cannot hear you, Nick. I just hear noise. That's all I'm hearing. Fran, do you have anything you want to add?
Chris, I have a question.
Yes, go ahead.
Do you know is there any news about the Brooklyn Family Support Fair?
Right now, I'm going to be straight with you right now. That's to be announced. And right now, the focus right now is the the answer to that question. It's going to be announced because
we don't know.
We don't know if there is going to be a family support fair this year between not just our borough, but I'm hearing other boroughs. So I'm going to say to be announced.
We have to wait, Matthew, to know of the new guidelines and how meetings or events are going to be held. So would I love us to have a fair? Yes.
Or a health fair.
A health fair, whatever. But at the moment, we don't know how it's going to be done or if it's going to be done, because that's all I can say.
Okay, got it.
All right.
But that is a good question.
And we'll bring that up to Joyce.
Well, Joyce already said we don't know at this time.
We don't really know.
I can, because her and I agree to discuss that. So right now I'm going to say to be announced, and we got to see. And I'm going to also mention if school's going back to session in the fall, to be announced. Don't even say no, it's not going to happen. As the governor,
we don't know.
As the governor said this clearly, to be announced. Please listen to any instructions when the governor makes the announcement, because it is right now in a New York State executive order. So we're asking everyone to please, 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 please be very careful. I see Miss Roseanne is on the screen now. Hi, you have anything you want to say?
Hello?
You're on mute.
No announcement on this side.
Okay, but hello. Nice screen.
Okay.
Okay, I want to thank everyone who attended the joint meeting. And as Joyce said, we'll be discussing, well, we're definitely going to have a meeting in June. But I remind everyone to please, guys, this is a serious thing. And I'm going to put this back on again. Please try to attend the Bfssac's update this Thursday at 9 a.m. live on the YouTube page, which you can click on it, and you can even type in the Bfssac update. You'll see the picture of the advisory council, and you will see us live. Now, any health provider wants to join in to speak, which they will not show their face, but they will speak, will be on the Ring Central. And if you need that information, please email me. And I'm going to remind everyone, we need to make sure our young early intervention children and up to the teens, up to the teenager, up to 18, 21, to make sure they stay healthy and strong.
And if we hear any more updates of more places that will be accessible for individuals with disabilities, developmental or what other, to be tested for the COVID-19 virus, we will also let you know. At this moment, we cannot give you an answer because we don't have that answer.
And things can change like snap of my finger.
That's right.
I want to thank everyone who came to our meeting. I can say our attendance was the highest in history. So I want, on behalf of the Brooklyn DD Council, I'm the vice chair.
And Deborah Greif, I'm the chairperson of the Brooklyn Family Support Service Advisory Council. We thank you all, and yes, we will keep you updated on any new changes that occur with OPWDD and anything else that can affect our population. With that, I want to say thank you, everybody. Please stay safe and healthy, and we'll be working together to keep our system intact. Thank you.
Thank you.
Dolores,
Thank you. Bye.
Dolores, stay on the line.
Yes.
Bye, everybody.
Thank you, everyone.
Thank
you.
Dolores, don't touch your screen.
Oh, don't touch it. Okay.
You got to wait a minute. I have to get everyone else off.